Hello, my patient this week is a new consult. She's a 19-year-old female who presented to our ED with intentional overdose suicide attempt. She states that she wanted to kill herself. She's had 3 other prior attempts, all 3 since she's been 16, and the 2 of them were trying to overdose on pills, and 1 was from trying to cut and kill herself. So the patient reports that prior to her overdose, she was drinking a lot with friends. She reports that after her friends left, she took some pills with intent to end her life. The patient reports she is uncertain of how many pills or what type of pill she took. She says she just keeps her medications in a little baggie and spends the night with friends. She reports that her roommate became concerned and called their neighbor, who was a police officer, and then the police officer said to call 911. We did speak to her older sister. She says that the patient recently, within the last week, moved out of her father's and stepmother's home and moved into a house with her friend. She reported that the patient was sexually assaulted when she was 6 years old, and also possibly when she was even younger, by her stepfather. She reports that whenever the stepfather would come in the room, the patient would just yell and scream, like, no, 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 get me away from him, he's a bad person. So that's why they think that. She also reports that the patient was admitted only 1 time for her suicide attempts because her father was against it and just wanted to take her home. Her sister reported that in the 6th grade, the patient started declining. She used to be a straight A student and was in gymnastics, and she was also very close to her stepmother. And her stepmother had a baby when she was in 6th grade, and I guess that's when she started to decline and started lying, cheating, and stealing. She has seen 3 therapists since 6th grade to now, and she just started seeing a new psychiatrist. The patient did attend family therapy with her biological mother, but had no success with that. She's not close with either of her parents currently. She does not take any medication for depression. She has a history of major depression and suicide attempts. She does have a history of asthma, and she takes 3 different inhalers for her asthma. And she said she thinks that she tried to overdose on her inhalers along with a bunch of other pills. She was admitted to Kobacker once when she was younger. She has a family history of depression and anxiety. Her mother, maternal and paternal grandparents have a history of depression and alcohol use, and father has a history of bipolar. She did state that she smokes marijuana and drinks alcohol. She denies HI or any plans to harm herself currently, denies auditory and visual hallucinations, she does not appear to be paranoid or having delusions. She's alert and oriented ×4. So our diagnosis for her was suicide attempt via intentional overdose and major depressive disorder. She meets criteria for inpatient psychiatric hospitalization as she continues to pose a high risk of harm to herself. Application for involuntary admission completed by the emergency department attending physician. and we recommended inpatient hospitalization when medically cleared.